Today we're going to talk, how do I know if I'm at risk for heart disease, the #1 killer of men and #1 killer of women. And if I'm at risk, what can I do about it? We'll get a little bit on that, depending on how much time we have, and that could be a whole other talk, but I want to get us thinking about this. Mythbuster #1. Since I was told my cholesterol was okay, I don't have to be concerned about my risk for cardiovascular disease. Get a little letter, seems in normal range, quote, okay. Reality, half of people who have heart attacks would have been told that their cholesterol is okay, in acceptable ranges. Half of people who have heart attacks have cholesterols under 200. Okay? Get your attention here. Mythbuster #2. Since I'm young, I really shouldn't be thinking about heart disease. You guys are all very young in here, so that's why I put that in. Heart disease, reality is heart disease starts years before there are any symptoms. And unfortunately, when you have a symptom, it's like the tip of the iceberg. There's been stuff that's going on for years and years, and we'll talk about that in a little bit more in a minute. So what's the first step? Find out how much or little risk you're at. Part of what I do is, when people come in evaluation or referral for evaluation of their heart risk, is to see if you're at low risk or high risk. I have patients that come in from referrals from other doctors. Cholesterol is 270. And they leave and I say, your lifetime risk of heart disease is very low. And then I have people coming in, cholesterol is 149. After the fact, after they've already had a stroke or heart attack. And then we look at the factors that are known to increase the risk of disease. Okay. Well, let's talk a little bit about the background. I'm big in education. I have 2 brothers that are teachers, and I love to teach and I love to tutor. Did that in college. So, background, first cholesterol. What is cholesterol? It's made by every cell in our body. If we didn't even eat any cholesterol, we'd make it. It actually takes about 30, 40 steps in manufacturing cholesterol from our body, in our body. It gives it the structural support to the membranes of our cells, kind of acting like rebar does to concrete, gives support, and also is a basic building block for all the steroid hormones. So it's not a matter of why did God make this if it only leads to heart attack, but it's the imbalance of that that can lead to problems. Cholesterol is a fat. If we just looked at it and had this here look like wax, and you can't, and your blood's mostly water, and you can't dissolve wax in water, right? So your body makes proteins that act like a mesh net. Those are called lipoproteins. Liposuction just means fat. So these are proteins that can carry fat, and those proteins themselves can dissolve in the blood. Years ago, 60s and 70s, scientists first discovering and looking at this found out some were fluffier. That's also known as, we're the science people in here, that's lower density lipoprotein. You guys are science people here? Okay. Gotta make sure. My wife said, make sure you don't get too complicated. But fluffier, lower density lipoproteins. And when they studied this, it turned out if you had a lot of the lower dense lipoproteins, LDLs, you're at much greater risk of developing heart disease. Then they found there's another protein that was less fluffy, higher density, called ApoA1. That if you had a lot of that, it was very protective. It lowered risk of developing heart disease. Antioxidant, moves excess cholesterol from the lining of the arteries, anti-inflammatory, probably antiarrhythmic. It does a lot of good things. If you have a lot of it, it's very good. You maybe heard of some of this already. Now here's the thing. The LDL is in these different proteins. You can have different sizes of these. If you have a bigger LDL particle number, a lot more cholesterol in it, the regular test is going to, the regular test called LDL-C that you guys get on most of the regular lipid panels, is going to measure the volume. But if you have a lot, let's say we could fit in this room 100 balls of that filling up the room. Now if we had smaller ones carrying less cholesterol, maybe it'd be twice as many. The regular test is going to give the exact same number. It turns out the biggest driver of risk is actually the LDL particle that carries the cholesterol. And so we'll talk about that in a couple examples. Here's this picture of the LDL carrying the cholesterol. So you have the same person, same cholesterol, LDL. Now they have twice as many. Over time, that can lead to heart disease. You have the plaque buildup called atherosclerosis in the lining of the artery. That can occur if you have too much of the bad stuff, not enough good stuff, smoking, diabetes, other things. Over time, what happens is that these LDL particles become oxidized. If the imbalance is shifted and too much of the bad, too much of the LDL, not enough of the good. Oxidized LDL particles are very irritating. Your body has immune cells called monocytes and macrophages, basically the same cell, just different location. They will gobble up these LDL particles, and then, unfortunately, they'll get stuck in the lining of the artery. We call those foam cells, and they form fatty deposits. Over time, over years and years, you'll develop one more of these and fatty deposits in the artery. But there's a protective cap over the lining of the artery. If you have a lot of the bad stuff, inflammation, high blood pressure, diabetes, smoking, and other risk factors we don't know that we're still yet to discover, you can get inflammation in the lining of the artery. What happens at a heart attack is suddenly that protective cap breaks down, or majority of strokes do. The cholesterol breaks for it, and within minutes, a clot can form. That's the same kind of process that occurs if you cut yourself, which is good if you stop bleeding, to help you stop bleeding. But if it's to your heart artery, it'll lead to a heart attack. And 1 out of 6 people will collapse. That's why at schools here we have defibrillators. In public places you have that. 5 out of 6 people go to the hospital and either get a stent or angioplasty done or bypassing. My goal, as I tell my patients, is I don't ever want you to get to that point, and we actually can ever keep you, identify if you're on that path, and then keep you from ever having that. If you already had that, you can lower the risk of ever developing that. So we talked then about the cholesterol imbalance in combination with the following: low amount of HDL or good cholesterol, smoking, diabetes, metabolic syndrome, high blood pressure. We'll talk a little bit about metabolic syndrome in a little bit. High blood pressure. HSCRP is a measure of this inflammation. There's another test called an LPPL2 that can also measure this inflammation that can be very helpful in assessing risk. And lipoprotein A, it attaches this to the bad cholesterol. It's, in a sense, like a sticky substance. It promotes plaque formation. And if you have a clot that's forming a heart attack, it actually inhibits breaking down that clot. So it's a double whammy. And that's completely genetic. And then family history can also factor